So, congratulations on winning the Antimicrobial Stewardship Award at this year's Journal of Wound Care Awards. So please, can you describe the work that you and your team have done which resulted in receiving this award?
So we initially did not set out for this to be an antimicrobial project at the start. It was more of a project about our community dressing formula was been reviewed, and what we did was we didn't have an antimicrobial dressing included on the previous formulary, so it was a chance for us to review all the products and review how our clinicians dealt with local signs of wound infections, what products we were using, and streamline that a little bit. So it gave us that opportunity to review. So the organisation was interested in developing clinical care frameworks, and we'd already got some clinical care frameworks in leg ulcer management, and pressure ulcer frameworks were already there. Other services as well within the organisation were also developing frameworks because that's the way the organisation wanted to go. So we managed to have a look at the product, have a look at what we were doing. So we also wanted to give clinicians Leeds covers such a vast area, and the tissue viability service covers such vast services. So we cover all community services, including children. We cover we have inpatient units. We cover primary care. The Mental Health Trust as well, which is a separate organisation. We cover those inpatient units as well. So we wanted to streamline it across all those services, and we wanted to give clinicians a framework that was at their hand, that was also hard copy and paper and also electronic copy when they were logged into the systems we have, that give them clear guidance on the local signs of wound infection, spreading infection. We also wanted to link that to the other templates that we used in Leeds Community Healthcare, so it links with News 2 assessments for the clinicians to use. And then also have the product that we wanted to advise there at the end, once if that patient was presenting with local signs of wound infection. We also put the products that it was what we call stock on shelves, so that the product was also there, so that clinicians could take that out in their boot stock, so that the patient had immediate access to that product once they were displaying those signs of local wound infection, rather than waiting to have a prescription generated and having to have that generated by the chemist as well.
Great, thank you very much. And how do you think that winning this award will affect your work and your team's work in the future?
I think it's really great. It's great. It's really good morale boosting. We are a small team, and that covers a massive service. And over the past few years with COVID, just like lots of other services out there, it's been really, really challenging for a specialist service. And we've just really plodded on with it. It raises our profile of the team within the organisation, within Leeds, and nationally as well, because it's a national and international award, which we didn't realise at the time, so that was a nice surprise. And it just makes a difference. It's really motivating for us that we can do something, and that we've been recognised for that hard work that we've done as a team, because it is hard work, and you feel like you've got to keep consistent. You've got to be consistent all the time with the messages you send in, and keep asking clinicians to go back to the framework. Have they looked at it? But it doesn't stop there really, because we're already looking at version 2, how we're going to keep moving on once it's embedded in practice, and keep moving forward.
Oh, that's so lovely, Joanne. Thank you so much. It's really inspiring to hear it from,
Thank you.
From, the ones at the coalface. So what is the most important aspect of your work, and why?
So I think it was mostly about patient safety. That's got to be our biggest aspect, because that's what we're all here for. And that local signs of wound infection are recognised early, when predominantly most of our work is done within a patient's home. So it's recognising those signs and symptoms of local wound infection before they develop into something more systemic, and acting upon those. And I think by having the framework, clinicians are able to use it. It's very clear what local signs of wound infection is, what to do if they've got spreading infection, if you've got patients that are high risk, and also having that product that is with them, it's there. The patient then gets consistent care across Leeds, and also all the other services that we interact with. So we're getting that consistency in treatment. And then also that nurses are supported with the decision making, because a lot of our nurses are in patients' homes by themselves, you know, and they're presented with these conditions, these signs and symptoms, and sometimes they've got a lot going on, especially with over the past few years. They just need that support with their practice. And it also aligns with international guidance. So we looked at the International Wound Infection Institute guidelines. So we're looking at bringing those national guidelines into local practice.
Great, thank you so much. And just to sort of summarize a few points, what would you say are the main challenges that you are currently facing?
I think because we did this framework pre-COVID, we were rolling it out then. I think that has been a big challenge. The challenge is ever-changing workforce in nursing. We've got such a younger workforce than what we did before, who need quite a lot of support, education, and not always have it. The staff can't always be released for education at the moment because of the pressures we have. So it's about going out with them and doing visits and promoting the visit. You know, we have to change how we work sometimes to be able to get that education out there, because things change. So it might be doing something more on Teams, you know, so that we can access more people that way, so they're not all having to come to a venue to us, and delivering that training more in the workplace and being more visible in those areas that we cover. Within Leeds, we call neighbourhood teams. So raising our visibility to get those frameworks embedded in practice. It's a challenge, but I think it's no other challenge that any other areas have, really.
Amazing stuff, amazing work. And just to end on a light note, so what advice would you give to wound care practitioners and researchers who are aspiring to make a positive impact within their field?
There's never a good time to do anything, and I think it's if you want to make that change, you've just got to start. Think about the change management process and those theories about how you're going to resistance to change, all those kind of things. Take those things into consideration. Plan, consult with those at the beginning who you think you need to be involved with. So it's really interesting to get those people there at the beginning. And ask clinicians feedback on the framework. So if you've got a rough copy, ask a staff nurse who's going to be using that framework, what do you think of it? How does it work in practice? Because it's okay as a specialist service developing something, but every day I'm probably not going to be I will be using it, but it's those clinicians who you want to support, who are in somebody's home, who are on their own, who have only been registered nurse for 6 to 12 months, who just need that guidance. So ask them, does this work for you? Are the colours right? Does it flow right? Does it read right? All those things, really. So it's about getting all those people involved. And once it's done, the work doesn't stop there. You do have to start thinking about, is the new research that's come out that's going to change that framework? Do we need to do other things with it to tweak it, to get it? Keep at it, really. It never stops.
Yeah, absolutely. Thank you so much, Joanne. Thank you. I really appreciated hearing, your insights and the team's insights.
Okay.